My name is Taylor Smith, and I'm a part of the Human Resources team here at Southwell. I'm based at Tift Regional Medical Center, which is our main campus in Tifton. My role is a Human Resources Generalist, and in that role, I support our inpatient nursing and nursing support departments through recruitment and employee support efforts. I have been a part and a member of the South Georgia Healthcare Group for the last 3 years. And what this group really does for us is connects us with educators and community resources in the area that help us build up our pipeline of people potentially interested in healthcare careers, and helps us find ways to keep our great local talent here and potentially future employees for us. So it's crucial for us to build strong pipelines. It's no surprise that healthcare is a growing field, and we only expect it to grow a lot more in the next several years and decade, and so we're always looking for ways to get more people interested in healthcare. Obviously, in order to serve our community, we have to have the staff to do it. So some of those roles that we typically struggle with, registered nurses, licensed practical nurses, respiratory therapists, even some of our frontline roles like CNAs and patient care techs. We really, through this working group, have the ability to partner, like I said, with educators, both at the K through 12 level and then at the post-secondary level, just make sure there's as much exposure to and excitement about healthcare as possible. I think that the beauty in the working group is just the ability to make those connections and build those relationships. And so I went to the summit yesterday, and then I was in the summit in 2019, and I'm also part of the working group committee. And that's really, the huge benefit that I see out of it is we're really able to make those connections and work together to be innovative and find ways to fill these roles. And we've done lots of things through this healthcare group at the K through 12 level. Where we really see it's effective is working with the educators both at the middle school and the high school level to just get kids interested in healthcare. So we're able to connect with people through this working group, and we go into middle schools and bring clinicians, and they're able to talk about what they do every day and really give them some insight in what a day in the life of a nurse or a physician is like. We're able to bring them into our facility for tour so they can see what it's like to work here and see the fantastic facility that we have that they could potentially work at later. We go in and we do mock interviews at the high school level. Through Amy Jones and the South Georgia Healthcare Group, we were able to put together a webinar recently where 3 different members of our HR team, we were able to join the webinars and talk through different just career prep things, and it was broadcast to healthcare pathway students all throughout South and Southwest Georgia. And we talked about things like writing a resume and submitting a job application, how to prepare for a job interview, and not even so broadly, but how to prepare for a job interview with our organization if that's potentially where you want to work. And then talk through some of our different, diversity and inclusion initiatives that we're doing with these kids. And so that was a really neat thing that we were able to do through this working group. At the post-secondary level, we see that we're able to really work specifically with the technical colleges and different universities in our area to make sure that we have the right programs in place, that the students are as best prepared as they can be when they come out of these programs. So are we as employers seeing any gaps in clinical skills or these soft skills where they can make some adjustments in the curriculum and just make sure that we're getting the best prepared students possible. That's been so helpful. And then we're also working with them to look at not only healthcare needs right now and the programs that we have available right now, but what are we going to need in 1 year, 5 years, 10 years from now. And we've been able to work with some of those colleges to build programs that will serve our workforce needs down the road. So Southwell is a growing healthcare system, and so we're really excited to be a part of this working group because not only have we grown a lot over the past couple years, but we certainly anticipate continuing to grow. So our main campus is here in Tifton. It's Tift Regional Medical Center. We recently opened, just in December of 2021, we opened a brand new 4-story patient tower, and that was just to be able to best serve our community. So in our old space, we struggled with some capacity, and so we were able to expand. We now have a brand new emergency department, a new intensive care unit, step-down unit, and orthopedics unit. So obviously with growth, it requires more staff, and so we're really excited to be a part of building these pipelines and keeping some of our great local talent local and showing them that we do have beautiful facilities here that they can come back and work at and have lots of opportunities in healthcare. My favorite aspect of my job is I really love recruitment. So I'm from Tifton, so being able to serve my local community and help meet our healthcare needs here. You know, healthcare is something that all of us will need at some point in our life. Everyone that we love will need at some point in their life. So it's really a feel-good job for me to be able to work to support our local hospital and make sure that our employment needs are met.